Welcome to the Etiology Professional Exfoliation Peel presentation. This is Catherine Pacelli, and I'm going to be your speaker educator today. I'm Director of Medical Aesthetics Training and Services for Etiology, and I'm also a Master Clinical Esthetician. I worked for plastic surgeons for 14 years as a medical esthetician, and so my background is very varied, but I really love the medical field and I love the things that medical aesthetics has afforded our patients and our clients over the years. If you need to get a hold of me, my phone number is 360-460-9111, or you can email me at catherine.etiologyskincare.com. I'd be very happy to send you our wonderful new manual and our treatment protocols free of charge. We can email them to you and you can download and print them. Etiology is a full-service skincare line. We have wonderful peels and products for the face, for the body, the hands, and the feet. And we also work with the spa professional on a more holistic basis. Even though we are a medical line, we have wonderful, luscious products that are very therapeutic in nature. So what are we going to talk about today? Well, we're going to talk about what are peels, what do they do. We're going to talk about natural peels, which are the glycolic and salicylic, and we're going to talk about chemical peels, which is our Gesner and our trichloroacetic acid, and our newest peel, which is an alpha hydroxy whitening exfoliator. We're going to talk about our target skincare, our causes, contributing factors, prevention, treatments, and protocols for acne, hyperpigmentation, and sun-damaged and mature skin. And then at the very end, we're going to do a short product knowledge of all of the wonderful products that we have and a little bit about how to use them. Over the years, glycolic peels and salicylic and Gesner's and trichloroacetic acid peels have become very popular. And, you know, when we're babies, our skin turns over at a very rapid rate. And that gives us that dewy, wonderful, squishy feel that young babies have. And that's because the cells are renewing and that there is no time for the cells to sit on the surface of the skin and get sun pollution and dirt and debris. And so that is the goal of using exfoliating peels or exfoliating equipment like the microdermabrasion machine. We want to trick the body into speeding up the cellular turnover, and the way to do that on a chemical basis or a natural basis is by using peels. Now, the cell turnover occurs approximately, if your age is 30 to 40, 28 to 45 days, and that's not too bad. You know, that will afford you a nice kind of glowing look. If your age is 40 to 50, it gets a little longer. It's a couple months. And then if you get to be my age, between 50 and 60, well, actually, I'm older than that. I am 69. It takes a good 60 to 90 days for the cells to turn over, and that makes kind of a dull look, and it's a sallow look. And so the object is to speed up that cellular turnover, and that is very easily done by resurfacing products like vitamin C, vitamin A, and by peels. Let's talk about natural peels. We have two types of natural peels here at Etiology. We have the alpha and the beta family of acids. Glycolic exfoliator is a alpha hydroxy acid. And our salicylic exfoliator is a beta hydroxy acid. And then of course we have our new AHA whitening exfoliator for hyperpigmentation. We have noted here that the glycolic exfoliator, it came from sugarcane and sugar beets, and that the salicylic comes from wintergreen or birch. And it also is a derivative of aspirin. So if you have a client who is aspirin sensitive, I don't think a salicylic peel would be good for them. Let's talk a little bit about our alpha hydroxy acid. We know several things, those of us who've worked in the industry and have worked with it. It breaks down the lipids that hold the dead skins to the surface. It kind of unglues the glue that holds the cells to the skin surface and allows all those dead cells to slough off. Glycolic acid is the principal alpha hydroxy which is found in sugarcane and sugar beets. Why do we use glycolic acid at Etiology? It has the smallest molecule and is the most skin active of the alpha hydroxys. Remember, the smaller the molecule, the deeper the penetration. Also, glycolic acid is more expensive than the alpha hydroxys, and a lot of companies don't use it, but we feel that it is um, more than worth the cost because of the dynamic results that we get using our glycolic acid peels. I've got a little chart here for you. It talks about our organic or our natural peels. As you can see, the glycolic acid has a carbon of 2, which means it is a smaller molecule, and it will go down deeper through the epidermis, heading down towards the dermis. Malic acid is apples. It has a carbon of 4. Tartanic acid is grapes. Citric acid is a 6 carbon. Lactic acid, sour milk, is probably the smallest besides the glycolic acid, and that's sour milk. And mandelic acid, that's almonds. Mandelic acid is also very good for hyperpigmentation, but it is a large carbon and it's hard to get into the delivery. So what does alpha hydroxyglycolic acid do? Well, we talked about the fact that it stimulates the cellular growth by getting rid of the dead skin that sits in the pores and sits on the epidermis. It also improves microvascular blood flow, which is really important to get the nutrients to the skin via the blood flow. It improves the clarity of the skin, and I'm an esthetician. I own a day spa. I've been in business 11 years, and I can tell you that after my clients get their glycolic acid peels, their skin glows, and it stays glowing for a week or so because all that dead skin is off of there and it has an internal clarity about the skin. And it's excellent. It prepares the skin for other treatments. I use our glycolic acid peels as a precursor to my microdermabrasion machine for a deeper, more penetrating treatment. It helps get rid of hyperplasia, keratosis, seborrheic and actinic skin, which is the sebum, warts, and problems relating to aging. So it really is very versatile. So what is salicylic acid? It's a beta acid. It works as a peeling agent, which means it contains hydrogen and oxygen atoms. It helps exfoliate dead skin cells and unclog the pores that lead to breakouts and impurities. I have to tell you, even at my age, I have breakouts and especially cysts. I don't know where they come from, but they can appear the next morning and I just get so frustrated. So my go-to kit is my salicylic acid from Etiology, and I zap some acid on there, use a little high frequency machine, and I tell you that cyst will go away in a matter of days. Salicylic acid treats acne, fights blemishes. It benefits oily aging and sun-damaged skin. It helps open clogged pores, helps prevent lesions, and it prevents pores from clogging in the first place. I use our beta alpha all the time, and it really is a great treatment to help you from getting those cysts and getting the pore clogging. Um, Now, beta hydroxy acid or salicylic, it also occurs in nature from sweet birch or wintergreen leaves. It is a derivative of aspirin. And like we talked before, if your client has aspirin sensitivity, I would recommend that you not use salicylic acid on her. It's great for the treatment of acne. The effects are very similar to Retin-A, but with much less irritation. It's soluble in liquid oil, and it exfoliates oily areas. That's what makes it so beneficial to people who have oily skin and have blemishes. What are some of the practical applications of salicylic acid? Well, we've gone over a lot of them. Another thing, it helps produce collagen. It increases the dermal and epidermal thickness and firmness. It reduces hyperpigmentation, helps heal and protect skin from the effects of photo damage and free radicals. It's a very versatile product. Some of the clinical applications are it sheds the abnormal cells and stimulates the growth of healthy new cells. That is really important. Daily use increases results in a normalized, more compact top layer of the epidermis and a thickening of the dermis. And it also helps create a reduction in wrinkles and scars. What's the difference between BHA and AHA? People ask me all the time. The biggest difference between the two is that they're hydroxyl acids. AHAs are water soluble and BHAs are oil soluble. BHAs are able to penetrate deeper into the pore, which contains sebum, and help control the exfoliation of the dead skin cells that build up inside the pore. And salicylic is the only BHA known for treatment of acne in acne-prone skin. What's the difference between AHAs and enzymes? Well, enzymes are like little Pac-Man, and they go and they eat up the dead skin cells on the epidermis. They don't go as deep, but if you want a nice, refreshing look, just kind of a pick-me-up, enzymes are really great. They come in many different types. We have, your mainly pineapple, papaya, mango, all of those types of things have these natural enzymes. I know that there's some pumpkin enzyme peels, and they're all really good, but they're not there for the long term. But I use them when people need to go to a wedding or they're going someplace special or getting their picture taken. It just refreshes the skin and gives them that really glowing look. Let's talk a little bit about our chemical peels. We talked about our natural peels, which is glycolic and salicylic acid. We have two phenomenal peels that we use here at Etiology. We have the Jesner solution, which contains salicylic acid, lactic acid, and resorcinol, and TCA or trichloroacetic acid. Now, there are peels that contain phenol. We don't use them. It's very strong. Back in the old days, phenol was really all we had before these designer peels were really invented. And the thing about phenol is it does destroy the melanocytes. So when you use it, you may get a nice smooth look, but you get a white look because you don't have the natural color anymore because the melanocytes or the melanin is destroyed. Some peels have a little bit of phenol in them, but using it by itself really is not done anymore. What is a Jesner exfoliation peel solution? Well, fortunately, ours is 17% instead of the standard 14%. So you're going to get a much better result from using ours than you will from a standard Jesner exfoliating peel. It was pioneered by Dr. Max Jesner. He was a German-American dermatologist, and it's thought to break the intracellular bridge between the keratinocytes, and it's very difficult to over-peel the skin due to the mild percentages associated with the acid combination. It has resorcinols we talked about, lactic acid, and salicylic acid. This peel consists of the three. So what are they? Well, resorcinol is structurally and chemical identical to phenol. It is what has replaced the phenol peel. Resorcinol is used to treat acne, seborrheic dermatitis, eczema, psoriasis, and other skin disorders. It's also used to treat corns, calluses, and warts. Resorcinol works by helping to remove hard, scaly, or roughened skin. So you can see why it's very important to have resorcinol in this cocktail of peels. Lactic acid, we talked about that before. It has a carbon of 3, so it's easy to get down into the epidermis and the dermis. It's derived from milk, and it's composed of alpha hydroxy acids. Lactic acid is not entirely unlike glycolic acid peels in their composition. These are fairly mild, and if you haven't worked with peels previously, a lactic acid peel is a good one to start with because you can't do too much damage. What is salicylic acid? We've talked a lot about that and what a great product it does, and does a myriad of things. So those are the 3 things that Dr. Jesner has put into his Jesner peel: resorcinol, lactic acid, and salicylic acid. Now we're going to talk about a TCA, or a trichloroacetic acid peel. In the late 19th century, another German scientist, P.G. Alna, discovered that an easy-to-make acid could rather neatly peel off a layer of skin. So they promptly marketed it, even back then, for skin rejuvenation. Today, that compound, trichloroacetic acid, or TCA, is widely used by dermatologists and estheticians both to brighten up aging faces and to remove damaged skin cells, including precancerous one, actinic keratosis. It's really good for that. Some of the results are very similar to the Jesner's. It helps create new fibroblasts, which promotes collagen development. It provides an overall healthiness to the skin, helps minimize 5 lines and wrinkles. It improves the skin tone, brightens dull, blotchy, uneven complexion. It helps dissolve blackheads, kills bacteria, and helps control acne. It fades discoloration. I use the TCA on my darker complexion people because it really is formulated for them, and helps them not have a recurrence of hyperpigmentation. And you have to remember that the darker the skin, the more sensitive the skin is. And so be very careful when you go to peel someone with the darker complexion, because they have a higher pain threshold, and they feel it much more readily than someone who has a lighter complexion. Okay, how do I know who is a good candidate for peels? And we really use the Fitzpatrick classification. I think it really is the best thing out there. We have the 6 skin types: the white, white, moderately brown, and dark brown and black. And let me explain a little bit more how we determine what it is. Types 1, 2, and 3 should do well but have sensitive skin. Check for unusual reddening or blistering during the peel process. Make sure your client gets a patch test 24 hours before the peel. This is very important, and I know a lot of estheticians skip this step, but believe me, you can save yourself and your client and patient a lot of undue stress and worry by doing a patch test. Types 4, 5, and 6 may be prone to hyperpigmentation and definitely need to use sun protection after a peel. Everyone needs to use sun protection. I live in Washington. That's where I am right now, in my home office in Washington. And I have such a hard time getting my clients to use sunscreen because they say, well, the sun isn't out that much. The UVA and the UVB rays are out there no matter if it's raining or snowing or if it's bright out. So you really need to wear a sunscreen. 90% of premature aging, according to the American Dermatology Association, is due to sun damage. So please preach sunscreen no matter where you are, because it is so important to maintain that good work that you're doing with your peels and your treatments for your clients. Okay, I made up this graph back in 2000 for Intaglio, which is the forerunner to etiology. And I think it still is a good graph today. It explains the Fitzpatrick classifications by ethnic regions. This has to do with their ethnicity. In other words, where their ancestors came from, because you have those genes in your genetic code, and it doesn't make any difference where you're living now. It makes a difference where your ancestry was as to what type of skin you have and how you're going to react to peels. The farther are you up to the Arctic circle, the Antarctic and the Arctic, that is a Fitzpatrick 1. Blonde hair, blue eyes, you're not prone to hyperpigmentation, but you may be prone to hypopigmentation, which is an absence of melanin. If you're Nordic, Scandinavian, Swedish, some German, you may be more prone to skin cancer because you don't have a lot of natural melanin that's going to protect your skin. Classification 2, you're just a little bit farther down from the Arctic Circle, and you have red hair, light eyes, white skin, freckles, cuperose, and you're also prone to rosacea. And that's your Scottish, Irish, Celtic, English, Welsh, and some Polish and German. Number 3, you're getting down closer to the warmer equator. You have darker hair and eyes. You're prone to hyperpigmentation. You could be Russian, Polish, German, some Native American, Asians, and Hispanics. Now we're going to classification 4. You're getting close to the equator there, and it's coming more hot and humid and high sun. You have dark hair and eyes, most Native Americans and Middle Easterns. Number 5 is you're right there in the tropical zone. African Americans, Asians, Pacific Islanders, some Indians from India, and Mexicans. And then you were right in the deepest, darkest, high sun, high humid part. And that's very dark hair and eyes, black skin, Indians, African Americans, and Egyptians. So this kind of helps you know where that classification came from, and you're able to identify the different ethnic regions, and that will help you in your decision to see where they fit on the Fitzpatrick classification. This is the Guga classification, and it talks a little bit about the typical age and what their skin characteristics are. So it kind of gives you a guide if you're dealing with someone who is 28 to 35, talks about their early photoaging. 35 to 50, they have wrinkles, what they call wrinkles in motion, early brown spots, some keratosis, parallel smile lines. 50 to 65, they called wrinkles at rest, advanced photoaging, discoloration, visible capillaries. I see a lot of that in my clients. And 60 and up, severe photoaging, yellow-gray skin color. They may have had some skin malignancies. And so this kind of gives you what is going on in their skin at the ages. Now, I have to say I'm 69 and I have none of the things that 60 and up have. And that's because I've taken care of my skin. I've used Etiology. I've used Intaglio. And I really believe in the product and I look great, and I have to thank the product for doing that for me. Okay, this pertains to our glycolic when we talk about the format for starting professional glycolic pill series. I believe a series is really the most beneficial way to go. A series of 6, and so we've broken it down to the skin type, sensitive or normal, oily or acne, dry or hyperpigmentation, and we'll be happy to send you all this. I have wonderful treatment protocols and a fabulous manual. It's a 100-page manual, everything you ever wanted to know about skin treatment, and I'm willing to send that to anyone who gives me a call at 360-460-9111, and I will email that to you, and then you can download it and go ahead and print it. So this is our guide for a 6-week series of glycolic peels. Now let's talk about pH. I've had people say, well, my glycolic is 70%. But you look and it's a 5 pH, which means it's probably really a 25%. The percentage is not near as important as the pH level of a product. The lower the pH, the more potential you have for absorption, or the more penetrating it's going to be. Products with a pH of 5 have a lesser potential for absorption. So we really want our peels to be in the low 4 and 3 range to be effective. Etiology's glycolic acid has a low pH. The lower the pH, the greater the stimulation. It results in faster cell turnover. And here's a little bit how you can see it. A 3, a 5, and a 7. 7 is neutral, by the way, and it's both neutral going up and coming down. I put together this. I love this. I think this is great. And it talks about the different pHs. And like a pH of 1 is can be as strong as hydrochloric acid secreted by stomach lining. That really blew me away. And alkaline, a pH of 14 can be as strong as liquid drain cleanser. I took some of the products on the market and did a pH test on them, and I was really alarmed to see that some of the soaps were up to 12 and 13. Bleach is an oven cleaner, and so you really have to be careful. If you have sensitive skin, you want a higher pH, but you don't want it to go over 7. And if you have acne, you can go up into the alkaline level, but not that high. You want to make sure it's beneficial to you. But this is a really good gauge right here. It's fun to look at the different things, and it's fun to take products from the grocery store and check their pH level. You'll be really surprised. Let's talk a little bit about skin anatomy. All you estheticians out there, you pretty much know this. We have 3 layers of the skin: the epidermis, the dermis, and the subcutaneous. In the epidermis, we have the stratum corneum, the stratum glandulosum, the stratum spinosum, and the stratum basal, or the basal layer. And then in the dermis, we have the papillary dermis and the reticular dermis. In our subcutaneous, we have that old friend of ours, adipose or fat. I think adipose is a much nicer word for fat. I would rather say I have adipose than I have fat. And this is just a schematic of what we talked about, the layers of the skin. So let's talk about peels and layering. How deep can the esthetician peel the skin and still be in compliance with California State Board? You have to check your state board. We're going to use California as an example. Now, here in Washington, we have much more leeway than any other state that I know. We can do medium deep peels, and we can also use lancets and do all kinds of things. We can treat acne, which is really great. I'm also licensed in California, and so when I go down there and teach, I'm really aware of how limited the estheticians in California really are. An esthetician cannot peel live tissue, so anything deeper than the stratum corneum and the top of the epidermis may be contraindicated. Now, in Washington, that's not necessarily true. We can go to medium depth, but we're talking about the laws in California. So therefore, the epidermis can be treated by an esthetician. When I worked for the plastic surgeons, I went down to the dermis, but I was working under their licensure. So really the only peels that we should be talking about is the very superficial peel, which penetrates part of the outer stratum corneum. I would say that the very superficial peel would be more like an enzyme peel, where you really don't go down and affect the epidermis. And you can do a very superficial peel by just taking your salicylic or your TCA or Jesner's and doing maybe 1 light layer or 2 light layers. And with the glycolate, you can leave it on a short period of time. Superficial peels penetrates the stratum corneum and the upper epidermis. We are allowed to do that. Now, the natural peels, the glycolic peel, it is on a time. It has nothing to do with how many layers you do with the glycolic peel. It's how long you leave it on. The salicylic, Gesner's, and trichloroacidic acids, those are peels that are layering peels. And the more layers you put on, the deeper the penetration. They're also considered to be self-neutralizing, but we like to use our post-balm anyway just to secure and make sure that the neutralizing has taken effect. So I would say for most states that the very superficial and superficial peel is where we need to be. Now the medium depth peel, that is the stratum corneum, the epidermis, and part of the upper dermis, and that is forbidden in most states. And of course, the deep peel should be done only by a dermatologist, plastic surgeon, or a nurse under the direction of a plastic surgeon or a dermatologist. We are not allowed to do that as estheticians. Now, is having to peel the only way to get results? Of course. We all know that home care products are very, very important. In fact, the line was developed because the plastic surgeon who developed the line couldn't find anything to give his patients after he had performed these wonderful treatments. So they were geared to give you maximum benefits after a salon peel. Etiology has great home care products, and you can get the same result. It's just going to take you longer. Salon peels, however, are not necessary to achieve maximum results. These professional products are compatible with both laser and chemical peels. Let's talk about some skin disorders and peeling. Let's talk about acne. We all know what it is. We deal with it every day in our practices. It's an inflammation characterized by superficial skin eruptions. This occurs when the sebaceous glands within the hair follicle, you can't have a pimple without a pore, the skin becomes plugged. Also, hormones, hereditary stress, humid weather conditions, bacteria, and increased sebum production can also produce acne. There hasn't been proven that what you eat produces acne, but we do know that sometimes salty foods that contain a lot of iodine can cause a breakout. Okay, we all know this. Open comedones, blackheads. Closed comedones, whiteheads. Most people with small pores have whiteheads. I have a lot of whiteheads as opposed to blackheads because my pores are small, but they're also hard to get out. And those states where you can't use a lancet, it's almost impossible. Papules, those are the red bumps that you see. Sometimes they contain pus and sometimes they don't, but those are considered a grade 3 acne. And pustules, for those of you who are out there estheticians, don't you just want to go and clean up this guy's face? I tell you. A cyst, that is the thing that I suffer from. And a cyst is an inflammation of several pores. And it's so frustrating because it doesn't really have a head. It doesn't necessarily have pus. Sometimes it does, but it's just this hard nodule that just sits there. Well, I tell you, our salicylic is fabulous in breaking up these cysts and drying them up and getting rid of them. So I suggest you take our salicylic right from the peel bottle, pour a little in your container, and just swab that cyst with our salicylic acid peel. Etiology peels to treat acne. I recommend that we use the glycolic or the salicylic. And of course, we have our new alpha hydroxy whitening exfoliator, which helps with the hyperpigmentation that is left after an acne lesion. So those three are really the most beneficial to working with your acne clients. Your glycolic would be light acne. Your salicylic is your heavier acne. And of course, everyone can benefit from the whitening exfoliator. Treating acne. You can combine salicylic and glycolic peels very effectively, lift the topmost infected layer, which dissolves the glue. Salicylic also penetrates deep into the skin and helps clear pores and reduces excess oil. I've written treatment protocols for acne, and I'm happy to give that to you. It's a wonderful treatment and it really works wonders. Let's talk about hyperpigmentation. Depending on where you live, hyperpigmentation can become quite a problem. I know in California when I was practicing, we had a lot of problem with hyperpigmentation. Not only were people at the beach trying to get tan, but we had a lot of ethnic people who were there. We had a lot of Hispanics and Mexicans and a lot of Asians who are very prone to hyperpigmentation. Glycolic and salicylic acid are excellent treatments. So is TCA, trichloroacetic acid. And it's especially good to treat the ethnic skin in it because it just has something in its ingredient that I feel is much more beneficial for the darker complexion. Now, we have wonderful home care products that contain both hydroquinone and kojic acid that we recommend that your clients use after we do our magic with our peels, and we'll talk a little bit more about that in our product knowledge. Here's a real client. She had, as you can see, acne hyperpigmentation. This is before, and this is after a series of peel with both glycolic and salicylic acid. And she got a wonderful result. And you better believe that we have her using sunscreen to keep her skin nice and free of hyperpigmentation. Let's talk about sun damaged and aging skin. There's three types of aging. There's environmental, intrinsic or genetic, and hormonal. Now, environmental is, of course, the free radicals that come in and destroy our cells by damaging their membranes. They can fuse the molecules together, making them unable to function properly. We all have free radicals in our bodies, but we can eliminate them by taking antioxidants and also by putting vitamins on the skin, and feeding the skin is one of the things that we have in our products that we believe in. Using the antioxidants on the skin is really going to help the free radical damage from the environment. You have pollution and dirt and grime and stress. All of these things contribute, and of course the sun, to premature aging. Intrinsic or genetic. There's not a lot we can do about that. You either hit the DNA lottery or you don't. But our DNA determines how well we age. And I have mother and daughters that come in to see me, and I can see the same aging patterns on the daughter as she gets older that is on the mother, and it's really freaky. She has the same line pattern in the same way because it is a genetic problem, and you are blueprinted to age in a certain way. There's not a lot you can do with that, but you can help with the environmental and the hormonal. Now, I'm at 69, so of course I've gone through menopause and I've lost some estrogen and progesterone. And that is one of the problems of hormonal aging. The production of growth stimulates and hormones, which cause and control growth, metabolism, and reproduction, decreases significantly after the normal reproduction cycle is completed. Then the body declines, fails, and dies. Well, that's really depressing. Due to the loss of small blood vessels, the decreased generation of new capillaries and blood supply to the skin is reduced. So you're not getting the nutrients that you used to do. But we have really great products that are filled with antioxidants and filled with vitamins that will really help perk up the skin and make it look healthy. My skin looks just as nice as it did in my 30s and 40s, and that's because I take care of it and I do all the things that we recommend here at Etiology. Cells show marked irregularities in size and shape. The epidermis becomes thinner and stretched. This leads to sagging and loss of elasticity. It shows more lines and wrinkles. Overall dullness and lack of clarity. But it doesn't have to be that way. You can do a series of peels and you can get that cellular turnover going, and you can really bring back sagging, dull skin. This is a picture that has been morphed, and we probably will never look like the third one, but it's kind of fun to see how the aging process is. In the late 20s, fine lines begin to form. In the early to mid 30s, the smile lines deepen, brown spot and freckles. The 40s, the skin sags and turns sallow. Onset of sun-induced skin cancer, a lot of us have gone through that. Worsening of wrinkling around the eyes, mouth, and all over the face. And of course, the 50s and 60s is where you lose a lot of elasticity. You lose the capillary action that keeps the nutrients coming to the skin. But you know, the products today are going to really make a marked difference in the skin, and you won't end up looking like our third model here. Don't forget to make yourself aware of the skin cancer lesions, the ABCDs of skin cancer. I can't tell you how many clients I've sent to the dermatologist because of a suspicious mole. And it's better to be safe than to be sorry. And I've saved a lot of people from having skin cancer by sending them to the dermatologist. It's up to you to really look at their skin, and if there's something suspicious, say something. Don't be embarrassed. If it's nothing, it's nothing. But it would be so much greater for you to find something and send someone to the dermatologist and save them all that pain and agony. Okay, let's talk about sun damage and aging skin and what we use to treat it. The Jesner solution is one of the best things for aging and sun-damaged skin, and the trichloroacetic acid also. Jesner's is really good for most of your skin types. The trichloroacetic acid, TCA, is better for more of your ethnic skin who have a darker complexion. All right. If you have any questions on peels and why they are important and why we stress it here at Etiology, just give me a call and I'll be happy to discuss anything that we've talked about. This is just a short section on our products. I'm going to be talking about our new Etiology product line and our beautiful packaging. This is what it looks like now. We have patent formulas, which is very unique in the skincare industry. We have home care and professional care, so we have a full line for everyone. Our target market is destination spas, wellness spas, day spas, full-service salons, schools, physician-sponsored day spas, and medical spas. In other words, everyone who is in the skincare field can benefit from our Etiology products. Our cleanser, now if you see a number after the product name, that tells you the percentage of glycolic or salicylic that is in the product. This is our workhorse. It's great. It contains 3% glycolic acid. I always list the pH so that you can see how strong it is. A 3.9 to 4 is a medium pH for a cleanser. So it's not going to stress the skin, or it's not going to strip the skin. It's really great for sensitive skin. It can be used as a shampoo for itchy scalp. And of course, it contains no sodium lauryl sulfate. And it's a non-alkaline formula, and it's fragrance-free. Our therapeutic cleanser, it's antibacterial, it's excellent, it's 100% fragrance-free, and it really helps with such conditions such as eczema, psoriasis, and rosacea. I use this for my eye makeup remover. It's very gentle, and it has vitamins A, B, C, and E, which is very important in skin health. Our loofah, this is a wonderful product. You can mix it with any of our cleansers. It can be used as a pre-shave exfoliator like a TenSkin. It's great to use in manicures and pedicures because it really gets rid of the top layer of the skin. The active ingredient is man-made pumice granules who are round, so you don't have to worry about the granules pitting the skin. It refines the skin texture. I love it, and I use it for all kinds of things. I put it in my shower, and I put it on my body if I'm feeling like I'm particularly flaky. Uh, so I really recommend that you get some of our loofah. It does not contain glycolic. This is our salicylic cleanser, and it contains 2% salicylic acid. The pH is 3.8. It won't strip the skin. It's effective in controlling blemishes and acne. It's a high-performance antibacterial gel. It's great for teenagers and adults. It's antiseptic and anti-inflammatory. It's everything that you need in a cleanser to help you with your blemished skin. And it's great to be used on spotty backs to help with all those blackheads on those blacks that I just love to get. Toner 8 is astringent that provides the removal of the surface oils and fats. It enhances the penetration of topical products. 8% glycolic acid, a pH of 3.5 to 3.8. This is excellent for oily and acne-prone skin. Teenagers can use it twice daily to combat oily skin and breakouts, or use it on your T-zone. Replenishing toner. This is a luxurious toner for those who have sun damage and aging skin. It hydrates, nourishes, and heals. Of course, it's enriched with vitamins. We want to feed the skin, and that's very important, to feed the skin with the vitamins B, C, and E, and pronogenol. Pronogenol is a great antioxidant. It has a higher pH so that it's for sensitive skin. It delivers temporary relief of itching, skin irritations, inflammation, and rashes, and it normalizes the skin's pH. Let's talk about our bleaching agents, our lightening gel with hydroquinone. This was developed to treat hyperpigmentation, skin discolorations, and uneven skin tones. It helps reduce pigmentation from acne. It's great for treating age spots on your hand and chest area. They say you can tell how old a woman is by her hands. I use it, and I also put sunscreen on my hands too. And I don't have those terrible spots because of it. Now, hydroquinone is for the average person. We also have our lightening gel with kojic acid, which is more for the Asian population. But the great thing about our lightening gel, it contains 10% glycolic acid. So you know that the hydroquinone is going to be going down and working in conjunction with the glycolic acid to really work in the epidermis and the upper dermis and really influence the hyperpigmentation that's going on. Always apply sunscreen after application. That is a given. Our lightening gel 10 has a 10% glycolic, but it also has ascorbic acid, vitamin C, and kojic acid. And this is ideal for clients who are sensitive to hydroquinone or that they're afraid to use hydroquinone. It's suggested for darker skin types and Asian skin rather than the hydroquinone. It's developed to treat hyperpigmentation, like we talked about, skin discolorations, and uneven skin tones. The beta alpha 10 is wonderful. I use it every day. It really helps keep my cysts from developing. It's a highly effective astringent. It contains both the alpha and beta hydroxy acids. It controls acne conditions, can be used topically for breakouts. It has an antiseptic action, and it helps reduce the bacteria and keeps the pores and follicles open. It's excellent for spot reducing treatment for teenage acne. If you start to get a blemish, slap some of this beta alpha on and it will really help treat that lesion. The active ingredients are 8% glycolic acid and 2% salicylic acid. Our gel 15, this is the strongest gel, and it provides therapeutic results. It's 15% glycolic acid with a low pH of 3.5 to 3.8. This is for your real sun-damaged, thick, leathery skin. It reduces the buildup of dead skin cells. The antiseptic action keeps pores and follicles open. I like to use this before I apply my vitamin serums, my vitamin A or my vitamin C. It's excellent resurfacing for arms, legs, necks, chest, or back, or ingrown hairs from shaving. The hydrating moisturizer. This is a very luxurious moisturizer. My clients who love that luxurious feel love this moisturizer. It's highly effective as an antioxidant hydrating moisturizer. It replenishes essential nutrients, restores the skin natural moisture balance, and delivers intensive hydration. It soothes and heals sensitive skin. It's anti-inflammatory, and it improves the cell nutrition. It contains the vitamins. Again, we want to feed the skin. It contains A, B, C, and E. Can be used in the morning and evening after cleansing. When used in the morning, always apply a sunscreen. This is a great product, and I sell tons of it. Ultra Cream 2. This is another multi-purpose product. Most people use it for an eye cream, but it can be used on other areas of the skin. It's a highly intensified moisturizer, and it contains no sunscreen, but it's really great for sensitive skin. If you have some dry flaking patches, Ultra Cream is wonderful. But it's basically used as an eye cream, and it's been very successful for us. Cream 10. This is a non-greasy lightweight moisturizer that's very hydrating. It contains 10% glycolic and has a pH of 3.7 to 3.9. It contains no petrolatum, contains no sunscreen. It's an ideal for clients with combination skin. And this should be used as a night cream. And it's an excellent night cream for someone who doesn't want a greasy cream on their face at night. Creme 20. Cream 20 is used as our hand and foot cream, but I tell you, I have many clients who swear by this as a night cream. It contains 20% glycolic acid. It's a rich consistency, and it provides a strong and effective resurfacing treatment to smooth rust and dry skins. It aids in reducing skin discoloration. It works great on calluses of the feet. A lot of my clients who are nail techs love this. They use it to get rid of the calluses on the feet. They apply it on the hand to slough off all the dead skin cells. It resurfaces and smooths the skin structure and texture, and it's great for aging hands due to the dryness and sun damage. It has a low pH. So it really is a treatment in a jar. It's wonderful. It has so many uses, and if my skin is feeling very particular dry, I will take a little Creme 20 and put it on overnight, and it really is a marvelous product. Okay, Lotion 10. This is great for those of us who have blemish problems. It's a high-performance, non-greasy day lotion, whereas Creme 10 is for night. Lotion 10 is for day. It helps lift the dead cells because it has 10% glycolic. It smooths fine lines and reduces acne scarring. And it's non-greasy lotion. It penetrates immediately. I have a sunscreen, SPF 30. It's a lotion which contains no glycolic acid. It protects the skins from UVA and UVB rays. In SPF 30, it absorbs immediately. This is a really great product. People love this sunscreen. It goes on nicely. It doesn't make your face look white. It absorbs immediately, and it stays on. But don't forget, when you use sunscreen, you need to reapply. Just putting the sunscreen on for the day and not reapplying is not going to protect you. It is the reapplying that is going to protect you from the sun damage. Lotion 10 also comes in SPF 20. I have a client that says that this product completely changed her whole skin, and that the fine lines and her acne scarring and all of that have softened. She has a nice glow to her skin, and she loves that it is an SPF of 20. It's a high-performance, non-greasy day lotion, and it penetrates immediately. It has UVA and UVB protection, and of course the active ingredient is 10% glycolic acid, so you know that you're getting that action that is going to help with the cellular turnover. Soothing cream. This is used for so many things. It is a great problem. It's a soothing and calming cream formulated to reduce irritation or redness on the skin. I use this after waxing. I use this if my skin is feeling particularly inflamed. It contains avocado, fractional distillations of lemon rind and hops. It has a natural moisturizer and an anti-inflammatory agent. It has physosterol, which provides like it's a hydrocortisone type benefit without the side effects. The pH is 5.5, so it's closer to the skin's natural pH. It can be used on areas of the skin that are irritated. Excellent home care moisturizer after a salon peel. Great for post-waxing. I use it all the time. It neutralizes any redness that may have occurred from the use of AHAs if you overuse your AHAs or your BHAs. It's just an all-around great product. If you have any irritation or rash, the Soothing Cream is the one to go to. Our cell mask is terrific for actinic and blemished skin. It's an antibacterial medicated clay mask. It helps to control blemishes and oil. It reduces redness and inflammation, and it penetrates deep into the pores, which helps reduce the bacteria while drawing out pore clogging debris and dead skin cells. It controls shine and heals the breakouts. It removes excess oil. It is a pH of 6.1, so it is not going to irritate the skin like a lot of clay masks do. The active ingredient is 2% salicylic acid and white clay. It's not hard to get off. It goes on smoothly. I use it for all my actinic clients. The rejuvenating mask is luxury and a feeling of being pampered in a tube. It's just wonderful. It's a treatment mask for all skin types. It's enriched with vitamins. We talk again about feeding the skin, A, B, C, and E. It has the MFF, which is the natural moisture factor, superior moisturizing properties, excellent after an AHA or glycolic peel or a microdermabrasion treatment. For my clients who want to be pampered and want something that's going to feel good and make their skin glow, the rejuvenating mask is really a luxurious way to go. Vitamin A. Now we're talking about some of the products that we have that are going to really give you a great bang for your buck. Vitamin A comes in an emollient, and it has visible results and rejuvenates the health and appearance of the skin. It is very similar to Retin-A without the irritation that is caused by Retin-A. It contains 7% retinol palmitate, and that is the most stable vitamin ester. The pH is a low pH, a 3.5 to 3.7, so you know the absorption rate will be good. It doubles the cell turnover rate. Yay! Normal rate is 28 days. It reduces it to 14 days. You can't beat that. Everyone should have our vitamin A. It thickens the epidermal layer and plumps out the lines. It doesn't cause redness, irritation, or photosensitive. It comes in regular strength, and it comes in 7%. And start out with the regular strength, and then you can go up to the 7% after your skin is acclimated. It's beneficial for all skin types. Used before the gel 15 to expedite the cell renewal process. This is great, as I said before, for clients that prefer not to use Retin-A or Renova, but they want the results. Now, with any of these products, consult with the physician if pregnant or nursing. This is a patented product, and it is a fabulous, fabulous way to really expedite the cellular turnover on your skin. Vitamin C. We all know the benefits of vitamin C. It firms the skin while increases the skin elasticity. It contains 25% ascorbic acid, and we have vitamin C at a lesser strength. It has a pH of 3.5 to 3.7, so you know that it is going to penetrate. It increases the fibroblast cells, and we all know what that does. That helps in collagen production. And it also inhibits UVA and UVB rays damage. So for all of you out there who have all the sun damage, vitamin C is really the ticket to help your skin get back its normal health and glow. It contains 1% pronogenol, the most powerful antioxidant available. It's 50 times stronger than vitamin E and 20 times stronger than vitamin C. You can mix this with Etiology sunscreens. It is a patented product, and keep it out of direct sunlight. These are our new peel packaging. I like them. I think they're clean, they're nice. And these, of course, are our brushes. Let's talk a little bit about our peels. First of all, we have the prep. You need to prep the skin with this product. It cleanses and defats the skin. It gets it ready to accept the peel. It's typically used in conjunction with chemical peel treatments to pre-treat the skin before the peel is applied. It can be used pre-waxing for better wax adherence. Oh, it is fabulous for that. It degreases the skin and the wax goes on and it gives you a better grip. Every person who does waxing needs to have our prep and our post-balm and our soothing cream. It adjusts the skin's pH to maximize the results of the professional exfoliating peels. It has a medium pH, 3.8 to 4.2, and you apply it to the skin being treated with a cotton square or a facial brush. Don't remove it because it prepares the skin for an effective peel result. Active ingredient is salicylic acid. Our post-balm contains a high moisture content and a volume of urea, allowing the skin to retain moisture. A rich moisture neutralizer for post-peels, waxing, or laser. It has a higher pH. It applied to the skin being treated with a cotton square or a facial brush. Do not remove. It neutralizes and calms post-peels, laser, and waxing. And the active ingredient is urea. It is a wonderful product. I use it after I use all of our peels. It really helps calm the skin and keep it becoming irritated or inflamed. Now, in our glycolic, we have 4 different glycolic strengths. Remember we talked about the pH being the deciding factor? All right, our glycolic exfoliator of 35%, 2.5 pH is our least strong peel. That's the peel that you start people out on to see how their skin is going to react. So that's the first peel that I would use on a client that I really don't know what their skin is going to react and how it's going to do. The next step up in your series of 6 would be your 50% 2.5 pH. So it's slightly stronger. And then you go up to your 35% 1 pH. A 1 pH is a very strong peel. That's the next step up in your series. Now some people will not get beyond that. They just can't tolerate it. Some will stay at the 50% 2.5. You have to be the expert and determine what is best for your client. If you have any questions, call me at 360-460-9111. I thought that was a great phone number. We have a glycolic exfoliator 50% 1 pH. This is our most potent glycolic exfoliator, and as I say, it's not for everybody, but if you have a client who has a lot of sun damage, has thick leathery skin, this is terrific. We have our salicylic acid exfoliator. It's 20% and its pH is 3, and it is a great product for actinic skin, For anyone who suffers from blemishes, it cleans out those pores, and it really helps address all the sebum in the pores, and it addresses the bacteria also. Our Jesner's exfoliator is 17%. Most Jesner's are only 14, so you really get more bang for your buck with us. It has a low pH of 2. It's excellent for all skin types, especially sun-damaged mature skin. And then we have our trichloroacetic acid or TCA exfoliator at 20%. It also has a pH of 2. And I like to use this on more of my ethnic skin. People who have a darker complexion, this seems to work better for them and keeps them from having a recurrence of hyperpigmentation. Of course, sunscreen is always mandatory. And then we have our alpha hydroxy whitening exfoliator 30%. pH 2, and this really is great. It's a great pick-me-upper for someone who suffers from hyperpigmentation. It can be a treatment all by itself, and it also is good for acne, people who have hyperpigmentation from acne lesions. So these are our resurfacing treatment products: medical strength glycolic and salicylic acid, Jesner solution, trichloroacetic TCA exfoliator, and the alpha hydroxy whitening exfoliator. We have classes, and most of the classes now are online, but I do travel, and if you want to get a large class together, let me know. We discuss how to do peels, how to use the Woods lamp. Everything that you ever wanted to know about peels is available. You can call me or email me, and I will send you our treatment protocols. They've been rewritten. I also wrote a fabulous 100-page manual that's everything you ever wanted to know about skin. Trust me, it's great. You can email me at Kathryn, Kathryn, dot etiology skincare at gmail.com, or call me at 360-460-9111. I'm available to answer your questions. If you don't get a hold of me, leave a message and I will get right back to you. Remember, I do have a working spa, so sometimes I'm with my clients. It was a pleasure to be able to do this for you today. Remember, Etiology is dedicated to the advancement of skin therapy through medical science. We are a partnership of estheticians, schools, dermatologists, and plastic surgeons. And for now, this is Kathryn Pacelli. You can find us on YouTube. I can also go ahead and email you this presentation. Thank you so much for listening, and I hope you enjoy our products as much as I do.